I think it's important when we think about subgroup analyses to think about when we should take them seriously and when we should treat them as what we call hypothesis generating. It's very common, almost every clinical trial will look at different subgroups of patients. Sometimes it's by age, sometimes it's by sex, various other characteristics either about the patients or about the disease. And it's really important to think carefully about when they're just an effective random chance, because you often get chance interactions between different variables versus when they are real, might be real and might be a real signal to take seriously. And so some of the characteristics that you need to look at when you're thinking about subgroup analyses are, was the subgroup analysis pre-specified, so before they did the trial, or did they see the data and then post hoc say they wanted to do the subgroup analysis? The second is there biological rationale? Is there a reason to really think this is true? Is it replicated in different studies, maybe done in different places or in different patients? Is the subgroup effect robust when you adjust for covariates? So is this subgroup analysis really a sign of something else, or when you adjust for other things, does it still play out that there's a relationship? And so I think you've got to line all these things up. And I don't think I mentioned biological plausibility. That is there a really good rationale? Does it just look at face value that this could be chance, or is there a lot of basic science and biological rationale to think that this effect might be true? And so I'd encourage people, when they're looking at the subgroup analysis of a clinical trial, to think through these different steps and to think, do I really think this is a real thing, or is this just due to random chance? I think it's really important.